Hello everyone. Today I'm going to discuss about valvoplasty. It's a very emerging technique in cardiovascular disease. First of all, welcome to my channel eduhub.2m. I'm Dr. Jayati Sen. Every day coming with new advancements of paramedical and medical aspects. The story of valvuloplasty starts with aortic stenosis. Now, aortic stenosis has emerged as the most common adult valvular heart disease with increasing prevalence in our aging population. This progressive narrowing of the aortic valve restricts the blood flow from the heart to the body. Now, we have to know why this aortic valve restricts blood flow, which is known as aortic stenosis, as because there is calcium deposition in the valve, and this gradually narrows the passage of the blood flow, and these valves are not shutting or opening properly with age, and also due to, written here, multiple comorbidities. Now, what is multiple comorbidities? It refers to the presence of two or more chronic health conditions in a single individual, often impacting their health and treatment. So generally these valves can be replaced with the help of SAVR. You can see surgical aortic valve replacement, but this is not possible for a patient with old age due to age, multiple comorbidities and compromised ventricular function. Now we have to know what is balloon aortic valvuloplasty. Where from it came? Introduced in 1986 by Dr. Elian Kribier as a revolutionary catheter-based procedure. Just uh, mind this, revolutionary catheter catheter-based procedure. So it is an invasive procedure designed to dilate the stenosed aortic valves without open heart surgery. Now, what is the mechanism behind this? The procedure involves inflating a balloon within the narrowed valve to fracture calcified nodules and stretch the valve tissue. Now, what is this calcified nodules which this balloon have to break? Calcified nodules are areas of hardened tissue containing calcium deposits. They can occur in various parts of our body, like lungs, then coronary arteries, then skin, and are often a sign of a healed or inactive process. While generally considered benign, they can sometimes indicate underlying conditions or be associated with specific health risk, particularly in the context of the cardiovascular disease. Now, what is the objective of this balloon aortic valvuloplasty, BAV? The primary goal is to approximately double the aortic valve area. You can see in this picture that a particular thing is inserted into the artery and it is going smoothly, fracturing all these calcium deposits and all, and reducing the pressure gradients across the valve and significantly improving patient's symptoms temporarily. Now, what is the mechanism? First of all, the valve tissue is stretched, then calcium deposition is fractured, then valve mobility increased, and pressure gradients are reduced. So these four are the key steps. So what are the key steps? Valve tissue strengthening, next calcium deposition is fractioned, then increased valve mobility, and lastly reduce the pressure gradients. So what is the primary action of this BAV? Fractures rigid calcific deposits on the valve leaflets. That means all the depositions which are on the valve leaflet, these are all fractured by the balloon. Disrupts commissural fusion between the leaflets. So due to deposition, whatever the fusion occurs, it also gradually demolished. Valve stretching alone produces temporary benefits. Calcium deposit fracture is essential for lasting improvement. Indications of BAV today. Bridge therapy. Temporary stabilization before definitive surgical or transcatheter aortic valve replacement. So before the valve replacement, this can be a bridge therapy, particularly in high-risk patients requiring optimization. Next, it's an emergency relief, rapid intervention in cardiogenic shock scenario or patients with critical AS requiring means aortic stenosis requiring urgent non-cardiac surgical procedure. So for this type of patients, it's a great emergency relief. Palliative care. Symptoms management is extremely frail or elderly patients, greater than 90 years of age and with multiple comorbidities. Diagnostic tool. So assessment procedure is low flow, means how slowly the blood flow is going. Low gradient AS to determine the true stenosis. Now what is low gradient AS? It is a condition where a patient has a small aortic valve area indicating severe aortic stenosis but a low mean pressure gradient across the valve. Now, procedural approach. Retrograde approach. What is this? The standard technique where the catheter is inserted via the femoral artery. You have to remember the name of the artery, that is femoral artery. So through femoral artery, the catheter is inserted and advanced in a retrograde fashion across the aortic valve. Prefer the most patients due to more straightforward access. So this is called the retrograde approach where the femoral artery is used. Next, antegrade approach. Less common alternative using venous access. That was artery access. This is venous access and requiring atrial septal puncture. Atrial septal puncture means septum between the two atrium. Reserved for patients with difficult atrial access or specific anatomical considerations. Now balloon sizing is also very important. Critical aspect requiring careful assessment with typical balloons ranging from 20 to 23 millimeter in diameter to achieve optimal valve opening without causing damage. What is the safety and outcomes in modern era? Intra-procedural mortality is only 2%, so it is safe. In hospital mortality 6% due to other causes and 40k plus 14k plus patients are studied and on the basis of which this too has been told. So now we have to know how BAV is integrated with TAVR. BAV use has increased as a strategic bridge to TAVR procedure. Now allow critical stabilization of high risk patient before definitive therapy. So TAVR gives a definitive therapy or if the patient is at all fit for this definitive therapy that is diagnosed by BAV. Provides valuable anatomical and functional assessment of the heart. Now what are the technical innovation? Lithotripsy associated valvuloplasty for heavily calcified valves. What is lithotripsy assisted valvuloplasty? It is a minimally invasive procedure that combines the use of intravascular lithotripsy (IVL) with balloon valvuloplasty to treat narrowed heart vessels, particularly in cases of severe mitral or aortic stenosis. Now, alternative arterial access route for challenging anatomy. If there is any anatomical problem, then also it helps. Ongoing research into optimal timing between BAV and TAVR. So between the bridges, how it can be bridged, still research is going on. What are the limitations and challenge of this BAV? Number one is stenosis. Degenerative calcified aortic stenosis inherently limits the long-term success due to elastic recoil and progressive calcification. Now, what is this AS? Means degenerative calcified aortic stenosis. It is a condition where the aortic valve, which regulates the blood flow from the heart to the body, becomes narrowed due to calcium deposits and thickening of the valve leaflets. And in most of the patients experiencing restenosis within 6 to 12 months. So this is a problem or limitation. Next, technical demands. Careful patient selection and precise balloon sizing are essential to minimize complications. So patient should be selected carefully whether the patient is at all fit for this treatment, and precise balloon size 20 to 23 millimeter to minimize the complications like aortic regurgitation. What is that? It refers to a condition where the aortic valve, which separates the aorta from the heart's left ventricle, doesn't close properly. This allows the blood to leak backward from the aorta into the left ventricle during diastole, means when the heart actually relaxes, and during the vascular damage and the conduction abnormalities. Now, role clarification. BAV does not replace the definitive valve replacement therapy but fits a critical gap for inoperable and hemodynamically unstable patients. Inoperable means the person who are not fit for the operation due to age or comorbidities, and hemodynamically unstable patient means one whose circulatory system is not adequately maintaining blood pressure and blood flow to perfuse vital organ. This instability can lead to organ damage and is often a sign of shock. Please like, share and subscribe my channel and stay connected with me to get the new notifications of new uploaded videos regarding various medical and paramedical topics. Thank you so much for your patient listening. Hope this video will upgrade your knowledge and help you to pass the examination smoothly. Thank you.